Welcome to this explainer. Look, facing a recurrent glioblastoma diagnosis, it's just an incredibly overwhelming moment for patients and their families, right? So today, we're going to walk through the objective, evidence-based medical pathways that specialists in Germany actually use when assessing a recurrence. My goal here is to give you a calm, clear, and highly structured look at exactly what doctors need to review to figure out what treatment options might still be on the table. Let's dive right into how this complex evaluation works.
Now, this explainer draws heavily on the clinical framework established by Euromedical Expertise. They're a coordination service led by Dr. Hind Halali, who is a German board-certified physician. And that's a really important distinction. This is a physician-led medical evaluation, not just a booking agency. Having a medical specialist lead the way is absolutely central to establishing a safe clinical pathway for you.
Okay, so let's tackle the main question. There's a very common misconception out there that a glioblastoma recurrence automatically means every possible treatment option is ended. Well, that is simply not the case. But the next decision doesn't happen in a vacuum either. It relies entirely on a highly individualized review of a few key things: your latest MRI, previous treatments, pathology, molecular findings, and, perhaps most importantly, the patient's current physical and neurological condition.
That brings us to Section 1, Evaluating the Patient Status. Let's look at the clinical variables specialists must review.
First up is expert neuroradiology. Specialists aren't just looking to see if a tumor is there, they're looking way beyond that. They have to assess the exact location and extent of the recurrence, the precise size, and how close it is to critical brain structures. Essentially, they're evaluating if it's surgically accessible. But here's a really crucial point. They also have to rule out what are called treatment-related imaging changes. This is a phenomenon known as pseudoprogression, where the tissue looks like tumor growth on the scan, but it's actually just inflammation from previous radiation. Identifying this early on literally saves patients from undergoing unnecessary aggressive treatments.
So along with the current imaging, the historical context is equally critical. Doctors absolutely must understand exactly what treatments were previously given, like what kind of surgery was performed, what were the exact radiation doses and techniques. Did you receive Temozolomide or another chemo? And most importantly, how did the tumor actually respond to those initial treatments, and how much time went by until the recurrence showed up? This medical history heavily dictates what can safely and effectively be tried next.
Now, moving into pathology, you'll frequently hear terms like MGMT and IDH. Basically, these are important molecular markers and genetic findings derived from the tumor's pathology. Think of them as the tumor's biological fingerprint. For example, a methylated MGMT promoter can actually indicate that the tumor might respond better to certain chemotherapies. Meanwhile, knowing the IDH mutation status helps doctors accurately classify how the tumor is expected to behave. So they give specialists a vital peek into the unique biology of the disease.
But I want to emphasize a really crucial point here to manage expectations. As this quote says, molecular markers provide important information, but they do not determine the treatment plan on their own. They're just one piece of a much larger, highly complex clinical puzzle. A responsible treatment plan requires evaluating the whole patient, not just reading a genetic readout on a lab report.
With that evaluation complete, we move to Section 2, Options for Recurrent Glioblastoma, and what specialists consider after a recurrence. A big question we get is, can another surgery be considered? The short answer is yes, but repeat surgery is absolutely not for everyone. It's discussed only for selected patients. This decision is strictly based on the tumor's location, the extent of the recurrence, the patient's neurological condition, and their overall general health. The surgical team has to carefully weigh the expected benefit of removing that tumor against the very real risks of causing neurological damage, which could severely reduce the patient's quality of life.
Now, if surgery isn't an option, or even as a follow-up to surgery, other pathways do exist, but it's vital to be clear here. We have to distinguish between standard established care, which might include carefully planned re-irradiation or systemic medical treatments, and investigational approaches, like clinical trials or specialized experimental immunotherapies, such as dendritic cell therapy. These experimental treatments require rigorous specialist review to determine if a patient is even a viable candidate.
Which perfectly leads us into Section 3, Multidisciplinary Tumor Board Review. This is where collaborative medical decision-making happens.
Because these options are so complex and individualized, a proper tumor board doesn't rely on just one single opinion. It's made up of specialists from neuro-oncology, neurosurgery, radiation oncology, neuroradiology, and neuropathology. They all sit down together, they review the imaging, debate the pathology, and look at the clinical picture as a collective team.
Complex brain tumor decisions literally require all of these disciplines collaborating to formulate the safest and most effective recommendation possible.
And that brings us to the fundamental takeaway for any international patient evaluating these options. Medical strategy first, hospital selection second. The priority has to be finding the specific medical strategy that fits the individual patient's unique tumor biology and physical condition. Just picking a hospital based on a brand name or some general marketing claims about being a top center, it's just not enough. You need the right expertise tailored to your specific case.
So, how do we get there? Section 4, Preparing the Medical File. Let's talk about compiling documents for a serious second opinion.
Initiating this high-level review process requires a completely full data set. You need the latest MRI and specifically the original image files, not just the written reports. You'll need the pathology report, including those MGMT and IDH molecular results if you have them. You also need all previous surgery and radiation reports, your complete treatment history, and the latest medical report detailing your current neurological condition. Without these complete original files, specialists just can't provide an accurate medical strategy. Honestly, they'd just be guessing.
Next is Section 5, Review Before Travel. This is all about establishing a safe clinical pathway.
For international patients, coordinating care across borders adds a whole other layer of complexity, which is exactly why the order of operations is so critical for your safety. Step 1, submit the complete medical file. Step 2, a qualified physician conducts a specialist review of that file. Step 3, viable treatment options are identified. Step 4, the patient is matched to the appropriate center that actually possesses that specific expertise. And only then, Step 5, travel logistics are arranged. Never book flights or choose a hospital before your specific case has been thoroughly reviewed.
And to really ground this explainer in medical realism, I want to read this quote directly. A responsible medical evaluation may conclude that a treatment is possible, that more information is needed, or that a treatment is not appropriate. This right here is the hallmark of genuine medical expertise. A review isn't a guarantee of a cure. It's an objective, evidence-based assessment designed to protect the patient's well-being above all else.
At Euromedical Expertise, led by Dr. Hin Halali, the process always starts with the medical case itself. The goal is to first identify the appropriate specialist expertise and then coordinate the next steps only when treatment in Germany or Switzerland is truly medically appropriate. I really hope this explainer has given you a clear, structured understanding of how recurrent glioblastoma cases are rigorously evaluated. My final thought for you to consider is this. When facing such a complex diagnosis, will you rely on general hospital marketing, or will you seek a truly individualized, multidisciplinary medical strategy? Thank you so much for tuning in, and take care.